Welcome. My name is Dr. Christy Seed, and I am the owner and physician at Acadia Integrative Medicine, and I'm presenting today on Heathy Bones, an integrative approach to treating and preventing osteoporosis. The reason why I wanted to publish this talk is I spend a lot of time in the office talking with patients about fractures, about bone health, and it's a big topic because fractures are not only common, but they're really debilitating. Often we think of, oh, we break a bone and we recover from it, but often the long-term implications are actually quite severe. Caucasian women in particular are at the most risk. Their lifetime risk of a hip fracture is actually 16%. And their lifetime risk of a vertebral fracture is up at 32%. So 1 out of 3 women who's Caucasian will experience a vertebral or a spine fracture in their lifetime. Fractures are also really serious in that there's significant consequences. When somebody suffers from a hip fracture, the long-term outcomes are actually quite grim. 20% of patients will end up dying within a year. And of those who survive, 50 to 60% of them will require some sort of help with their activities of daily living, which is like helping with washing or going to the bathroom or making their meals, things that most of us really want to remain independent for the rest of our lives. I often like to start with just talking about what exactly is osteoporosis, how is bone formed, and what does osteoporosis look like. Osteoporosis, the term, is osteo, which means bone, and then porosis or porous. So if you think of your bones as hard sponges, the osteoporosis is that you get more porous areas, more holes in your sponges. And we need our bones to have holes in them, otherwise our skeletons would be so heavy we wouldn't be able to move around. The holes in the bones allow us to have a light enough skeleton to move. The challenge is, as we get older, often those holes become much more present. There's less bone structure, thus leading to fragile bones. We diagnose osteoporosis by doing something that's like an X-ray called a bone density scan or a DEXA scan, and we focus on 2 areas, one being the lower spine and the other being the hip. I like to talk about the hip measurements in particular because these often are confusing for patients. When they look at the hip, they look at the top part of the femur or the bone that goes into the hip, and they look at what's called the neck of the femur. Often patients say, I don't understand, my report says they're looking at my neck, but they didn't do any kind of study on my neck. And I say, no, it's the neck of the femur. So we're looking at the spine or the vertebra and also the neck of the femur, as well as other parts of the hip bone. When we do a bone density scan, we compare people to a healthy 30-year-old. So it doesn't matter how old you are, your scores get compared to a healthy 30-year-old. And the reason for that is our bone mass and strength peaks around age 30. So a healthy 30-year-old typically has a score somewhere between -1 and +4. And so when you get a score on a bone density, it's called a T-score. And if you're in that -1 to +4, you're kind of pretty average. If you go to the -1 to -2.5, you're not quite at a diagnosis of osteoporosis, but you're in a classification called osteopenia, which means there is thinning of the bones. And then a -2.5 or less results in a diagnosis of osteoporosis. And at that point, there's a much higher risk for fractures, which is why we then diagnose it as osteoporosis. When we look at risk factors for osteoporosis, probably our #1 risk factor is age, because as we age, our bones tend to shrink or to get more brittle. And that's because, as I mentioned earlier, we're building bones up until we're about 30 years old. And then from age 30 to age 50, we have a slow decline. And then women in particular, I'm going to focus a lot of this talk on women, and I'll explain why in the next slide. We don't see as much bone loss in men in general. But women, once they hit menopause, those first years after menopause are really, really crucial. And that's often when there's rapid loss of bone strength. And then after they get to age 60, 65, that bone loss seems to slow down. Gender is also a risk for osteoporosis, particularly being of the female gender. And that's because if you look at this graph, I really like this graph because I'm going to use my pointer here. It shows that men have much higher peak bone mass, and that even though they lose bone over the years, their drop almost never gets below what is for a female their peak bone mass. So men, they just maintain strong bones, and this has to do with testosterone and a lack of estrogen. Women, on the other hand, we peak around age 30, and as I said, after menopause, quickly lose bone strength or bone mass, and then continue to drop, but not nearly as significantly. So being female is a risk factor for bone loss. Ethnicity is also a risk factor for osteoporosis. In particular, being Caucasian or Asian are higher risk factors. Women of non-Hispanic Black ethnicity, much lower risk for osteoporosis. A family history. If you have a first-degree relative, particularly a mother, a sister, that significantly increases your own risk for osteoporosis. Having a low BMI, or body mass index, being particularly thin. This is one of the few times where most of health is about wanting to keep your weight down and being thin, but unfortunately, our bones respond to stress. And so if there's some sort of stress, carrying heavy weight, that increases bone strength and builds bones. So if you're thin, you don't have as much weight you're carrying around, so bones tend to not be as strong. That being said, I don't recommend that everybody go out and eat McDonald's and pack on the pounds, because there are so many more health implications for being overweight or obese than for being thin. However, somebody with an exceptionally low BMI, women who have a history of eating disorders, this often is a higher risk factor for osteoporosis. Long-term use of steroids. Sometimes for medical purposes, women or men need to be on steroids for an arthritic condition or an asthma, and this can lead to bone loss. Smoking, huge risk factor for osteoporosis. We're starting to get into the modifiable. They're things that we have some control over. Definitely there's a million and one reasons to quit smoking, and bone health is just a million and two reasons now. Excessive drinking of alcohol also increases risk of bone loss. In particular, having more than one or two drinks a week, depending on if you're male or female, increases your risk for osteoporosis. So as with everything, there is moderation, and I do recommend not drinking to excess. A low calcium intake, definitely, we all are pretty aware of this. If you don't have the building blocks for bones, the calcium, then it's unlikely that you're going to be able to build the bones. And going along with that, calcium is put into bones with the help of vitamin D. So if you have a low vitamin D intake or low sun exposure, therefore producing less vitamin D, you have an increased risk for osteoporosis. A sedentary lifestyle, this goes back to what I was talking about, where bones respond to stress, and stress makes bones stronger. So if somebody's sitting around in a rocking chair, or just really somebody who's has more of a desk job and doesn't take isn't able to get out and walk or do something that's going to put some stress on those bones, they're going to have increased risk for osteoporosis. So now I'm going to get into some dietary tips for keeping bones strong and healthy. So the recommendations for calcium are to get around 1,000 to 1,200 milligrams a day. It depends on your age. Once you're over 50, most of the different organizations agree that you should be getting around 1,200 milligrams a day of calcium. There's a change here, though. It used to be that there was a recommendation that you should take 1,200 milligrams of supplemental calcium in addition to what you're getting in your diet. Recently, there's been some studies showing that perhaps taking too much calcium could lead to buildup of plaques on the coronary or the heart arteries. And so those guidelines are being scaled back. And what I'm recommending is that patients get a total of 1,200 milligrams between their diet and a supplement if necessary. And very important, if the dairy is not consumed with vitamin D, it doesn't necessarily promote bone health. So again, this partnership between calcium and vitamin D is really, really crucial. So That leads me to talk about how dairy is not our only source of calcium. If I were to ask somebody, okay, how much calcium do you think you get in your diet? Everybody, including myself, usually goes to, well, I have some yogurt and a little bit of cheese. I don't drink milk. Um, Instead of thinking, well, I eat tofu and broccoli and salmon. And so I spend a lot of time with patients in the office talking about other sources of calcium other than dairy. I think we all have been influenced by this notion that the only place we can get calcium is dairy. And not that we can't get some of our calcium in dairy, but I think there's a lot of other, even more beneficial foods that could help with that. And here's a general list, and we're going to go through some of these by different food categories. So these are some vegetables that are high in calcium. In particular, if you look at the list down towards the bottom, we have spinach. 1 cup of spinach has 240 calories in it, 240 milligrams of calcium in it. And a cup of broccoli has 180 milligrams of calcium in it. So through your diet, again, you would have to eat a lot of broccoli to get those 1,200 milligrams a day, but that's definitely a good source. And at the end, I'll show you dairy content so you can kind of compare. Here are some of our protein sources, particularly our non-meat protein sources. So soy is awesome. Tofu in particular, particularly calcium set tofu, has huge quantities of calcium in it. So I'm a big proponent of soy protein in general. It's not only helpful for our bones, soy protein's been helpful to reduce cholesterol, and there's many other benefits for soy. So excellent source of calcium in our diets. And then our oily fish are great sources of calcium. So our salmon, a serving of salmon has around 200 milligrams of calcium. So if you think about, well, for dinner I had broccoli and salmon and a cup of soy milk. You've got over half your daily intake of calcium right in that meal. So what I usually tell patients is go through your day, write down what you ate, and then kind of put it in a food calculator, something like MyFitnessPal or some other food logger that will give you a calculation of how much calcium you consumed in your day. And look and see, are you close to that 1,000 or 1,200 milligrams, or are you far below it? And based on that, we can decide whether or not you might need a supplement. And just for comparison's sake, here's dairy and the sources of calcium. It does have calcium in it. I don't want to neglect that. However, it's just, if you look at a cup of milk, has 300, and your cup and a half of spinach would have the same amount. So going into those calcium supplements, we just talked about a combination of diet and supplements. So if you're well below the 1,000 or 1,200 milligrams a day, then I do recommend taking a supplement for bone health. The average U.S. female is supposed to be getting about 500 to 600 milligrams a day. So most women do need some sort of supplement to promote their bone strength, bone health. I get a lot of questions about, well, which supplement? And often it's which one will you take and consistently. So some women, if it's just hard to take a pill, especially calcium tends to be a really big pill, I recommend, something as simple as the calcium chews. If you're great at pills, then calcium citrate is often a really good choice because it's well absorbed, even if you have low acidity of the stomach. Calcium carbonate, which is what we find in Tums, is probably our most basic form of calcium supplements. That's better absorbed if taken with food and works, but just need to be more aware of when it's being taken and what with. Finally, there's bone meal out there. It's a microcrystalline hydroxyapatite, and it also has a lot of different minerals in it and often beneficial as well. Many other forms of calcium supplements. The bottom line, when they look at studies on calcium supplements, the most important thing is to be taking it. And the difference between these different calcium supplements and bone strength is really negligible. So vitamin D, another source of really important nutrition for our bones, because vitamin D controls the absorption of calcium in the gut and also how it's deposited into our bones. So If your vitamin D level is good, i.e. up around 35, you will absorb 65% more calcium through your gut than if your vitamin D level is low at, say, 20. So vitamin D is something that I spend a lot of time in the office talking with patients about because we live in Maine. And often, because we live in Maine, we're not exposed to sunshine as much as, say, down in Florida. And if you're not taking a supplement, often you're not getting a sufficient amount of D. Vitamin D is associated, low vitamin D levels associated with higher risk for hip fractures. And it's been shown that just supplementing with vitamin D reduces that risk for hip fracture. So this is a nice study because a lot of times we're finding that vitamin D is very important in many different disease processes. But we don't have those follow-up studies to show if you supplement with it, it reverses the disease process. Here we actually do have some studies showing that it reduces hip fractures. So unfortunately, there aren't any great food sources for vitamin D. There are some fish, like sardines, have some vitamin D in it. If you take your mushrooms and you actually put them on a cookie sheet out in the sunshine for about 20 minutes before you consume them, they will then have some vitamin D in it, which I just think is a fun little factoid. I don't think most of us are going to be eating enough mushrooms that we've put out for sunbathing to get a sufficient amount of vitamin D, but it's kind of fun. So because we live in Maine, when I check vitamin D levels, so many are low, and I recommend at least 1,000 international units of vitamin D for all adults living in the northern latitudes. And if you have a history of a deficiency, more like 2,000 international units a day. Things that you can avoid in your diet to promote healthy bones. One is caffeine, particularly from coffee. So if you're drinking four or more cups of coffee a day, then you're at risk for increased bone loss. So tea, interestingly, doesn't seem to affect bone strength or bone density. So if you are feeling you're having a tough day, you really need to have that extra caffeine, then switch over to black tea. Alcohol, as I mentioned before, is a risk factor. Ideally, you should be drinking less than 7 drinks a week in order to maintain bone health. Soda, such as Coca-Cola or Pepsi, with just generally not great for health, and they've shown that you need to be consuming less than 5 servings of soda a week in order to maintain bone health. And finally, vitamin A supplements. If you're getting too much vitamin A, that actually works against you, not only for bone health, but for multiple different ailments. So it's one of those that if a patient comes in with vitamin A as a supplement on their list, I almost always say, we don't need extra vitamin A. Finally, animal protein. So it's really beneficial for bones to have more of a plant-based diet. I'm not saying that everybody needs to be a vegetarian or a vegan, but we do know that high levels of animal protein do tend to lead to decreased bone strength. Finally, the things that I want you to eat more of for your healthy bones, we kind of touched on this, but lots of fruits and vegetables, ideally 8 to 10 servings a day. More omega-3 foods, that's your oily fish that we were talking about, the salmon, flaxseed, walnuts have a great source of omega-3s, and then your soy foods. Other supplements that you might want to consider for bone health, one is vitamin K. Vitamin K has been shown to work with vitamin D to build bones, and a deficiency in vitamin K is associated with fracture risk. One meta-analysis actually showed that supplementing with vitamin K reduced fracture risk by 80%, which is pretty remarkable. When we talk about vitamin K, I always want to put out some cautions. Ideally, we get our vitamin K through our food sources, but if you're not getting a large supply of leafy green vegetables or fermented foods, cheese, then I would recommend that you consider a supplement. Vitamin K1 has been associated with improved bone health, as has vitamin K2. Vitamin K3 is toxic to the liver, so you don't ever want to get a source of vitamin K3. And if you are on a blood thinner of any sort, you want to check with your doctor in regards to vitamin K, because vitamin K definitely interferes, particularly with Coumadin. Another supplement to consider is magnesium. Magnesium has been found to increase bone density in postmenopausal women. And the majority of women in America, when we do studies to look at just general nutrition, something around 60 to 70% of people in America don't consume enough magnesium in their daily diet. Um, Generally speaking, magnesium is a safe supplement. You do want to make sure that your doctor has checked your kidney function before supplementing with large doses of magnesium. I use magnesium a lot in my practice. If somebody has constipation or leg cramping, usually one of my first go-tos is, let's get you some magnesium. Often patients ask me about a calcium magnesium supplement. I say, hey, unless you're really sure that you're getting enough magnesium in your diet, it's one of those probably a good idea things. We do need more studies on magnesium in regards to bone health in particular. Other supplements that are mentioned out there in the literature include strontium, vitamin B, vitamin C, potassium, the phytoestrogens, and then some Asian herbals such as shu dishan and shengu. These really, I don't feel like there's enough studies about them or at this point to strongly recommend for them. The strontium is something that is prescription only in Europe. The others, generally speaking, I focus more on diet, looking at the supplement, the potassium or the calcium and vitamin D intake and optimizing those. Exercise. Probably one of the most important things you can do for your bones is to have regular weight-bearing exercise. We know that that prevents fractures. Walking reduces hip fractures by up to 30%. And the benefit from exercise, unfortunately, if you stop exercising, the benefit is lost. So you got to keep going. You can't just say, oh, well, I exercised when I was young, so I must have strong bones. You got to keep going with it. And I love walking because generally speaking, it doesn't require anything other than a good pair of shoes. So get out and go for a walk. You do need to walk fast. If you're just strolling along, that's not really going to do it. You need to walk at a moderate pace of like 3.8 miles per hour, which is a pretty good clip. Tai Chi has been shown to reduce the risk of falls in the elderly, helping more with balance than actually bone strength, but ultimately our goal here is to prevent fractures. So Tai Chi has been shown to be very helpful for women or men with osteoporosis for preventing fractures. So when are pharmaceuticals recommended? What we do to figure out if somebody's, we've done all the diet and the lifestyle modifications and somebody's bones are just brittle, we calculate what's called a FRAX score, and it takes into account age, sex, ethnicity, height, weight, bone mineral density, and some other risk factors. It's the calculator that looks like this, and at the end of the day, when we've put in those T-scores, it gives us a 10-year risk for a major osteoporotic fracture and or a hip fracture. If the risk for a major fracture in 10 years is greater than 20%, or the risk of a hip fracture in the next 10 years is greater than 3%, then medication is recommended because the risk of the medication is considered to be much less than those long-term risks of having these fractures. Also, that T-score being less than 2.5, negative 2.5, that's considered osteoporosis, and many clinicians will start a bisphosphonate or a medication with that criteria as well. So the medications for osteoporosis, the most common, it's the only one I'll talk about here today, is the bisphosphonate. These are first-line medications, and what they do is they slow the bone breakdown by inhibiting these things called osteoclasts. I like to think of osteoclasts as these Pac-Men that are in our bones kind of chomping and down the bone. And then there are osteoblasts that are also there, and they're building the bone back up. And the problem is with osteoporosis, the osteoclasts are working harder than the osteoblasts, so we have bone loss. The bisphosphonates move in, they slow down the osteoclasts from breaking down the bone. Probably the most common name that people are familiar with is Fosamax, which is a alendronate, and this is one of the bisphosphonate medications. The goal of these medications is to increase, or ideally, often it's just stabilize bone loss. We don't usually see huge bone gain or growth when somebody's on these medications. They have been shown to reduce the risk of fractures, and generally they're not given for long periods of time. Fosamax, the oral bisphosphonates, are generally given for about 5 years, and what they found is that the bone strength after the medications are discontinued decreases, but it's at a very gradual rate, and they don't have any more loss than somebody who's not taking, is continuing to take the medication. Probably the most common side effect of these medications is irritation of the esophagus or reflux. You need to take them on an empty stomach and sit up for 30 minutes afterwards. Therefore, fortunately, they're just taken once a week or once a month, depending on the formulation. Probably the most serious but rare side effect is something called osteonecrosis of the jaw, where the jaw bone doesn't heal properly, particularly after some sort of dental procedure. I bring it up mostly because it's out there in the media, kind of big warnings, and it is serious, but it also is very, very uncommon. Usually it occurs with the IV forms of the medications rather than the oral forms. So the things I want you to remember today: bone health starts at birth, diet makes a significant impact on bone density, exercise is essential, and supplementing with vitamin D is pretty much absolutely necessary in the state of Maine. Thank you very much.